Hi, and thanks for making it to this section. We're going to be talking about some pharmacology principles, specifically special considerations for the pregnant patient. And it's real important that we ask the female patient if she is pregnant before we administer drugs, because some of the drugs can adversely affect the fetus. And we have to really sit down and think, does the risk of this drug affecting the fetus outweigh the benefits that the drug can give to the mom? If that's the case, we're not going to give the drug. But if the drug greatly outweighs the risk, then we're going to have to do it. And remember, mom's life comes first, because if we lose mom, we lose the fetus as well. So prescription and over-the-counter drugs can harm the fetus, so we have to be careful of what medicines that the mom takes. And usually if mom's getting regular prenatal care, she's going to be very aware of what drugs she can and cannot take. And something I want you to think about too, that there's a lot of physiological changes that go on that happen to a woman when she's pregnant. Her metabolism increases, her blood volume increases, liver function decreases a little bit, she excretes more, and so on. Excretes more urine, that is. So these changes can affect the way drugs are metabolized and processed through the body. So we're not going to get the same effects out of a pregnant woman sometimes as we would a non-pregnant female. So the FDA has developed a scale that helps us determine what drugs we can and cannot give to a pregnant patient. So Category A drugs are the good drugs. There's no documented risk to the fetus at all, or the mom in this situation. However, Category B, we start getting a little shaky, because some of the studies in animals have not really shown a risk, but there have not been adequate human studies to really verify that there's going to be no risk to fetus. Because, as you know, or hopefully you know, that you can give animals can receive medications through clinical trials and have no adverse effects, but then when it gets to the human population, we have some adverse effects. So we really don't know 100% in the Category B. So in Category C, we have adverse effects demonstrated in animal studies. And of course, if that's happened, then they're not going to conduct human trials at all. So Category C, you're definitely going to stay away from. So Category A is going to be okay. Category B, well, we're really going to have to weigh the risk and benefits against each other. Category D, the risk to the fetus has been demonstrated, so we are definitely going to stay away from D. But however, if the time comes, if it comes down to it, and the administration of these drugs outweigh the risk to mom, then we're going to have to maybe consider taking it. For instance, if mother's having an anaphylactic reaction and her airway's closing up, well, then we may have to give some drugs to help save her life in that emergent situation. And Category X, these drugs clearly have been demonstrated to have adverse effects in humans and should not be administered to women who could potentially be pregnant at all. So many drugs have unknown effects during pregnancy. One thing about that is that there's not many pregnant women lining up to be involved in clinical trials. And I can understand why, because I wouldn't want my wife risking harming our child just because. So in accepting life-threatening situations, it's better to delay a pharmacologic treatment. And if you have to give a pharmacologic treatment, then you may want to contact medical control as well. So that concludes this section on special considerations for the pregnant patient. We've just got a few more sections to go, and we'll continue moving on along.